I'm Emma Hammett from First Aid for Life, and today I'm going to cover very briefly what to do whilst waiting for an ambulance. Our ambulance is under more pressure than ever before at the moment, and people talk about the 8-minute target time, but actually what they don't realise is that 75% of the ambulances have to arrive in that 8 minutes time. So it isn't an 8-minute absolute, it's that they're aiming for 8 minutes and only 75% of them have to get there in that time. And for non-life-threatening emergencies, it's 19 minutes wait time. So you could be waiting for an awful long time for an ambulance to help you, which is why first aid has never been so important. So what I want to do is just go through what you should be doing if you are waiting for an ambulance. So you found somebody who is in medical distress and you need to call for an ambulance. So take a deep breath, collect your thoughts, stay calm, and check for danger. So check that it's safe for you to approach them, and be aware, look around and see what might have happened, and ensure that you're maintaining your safety and that of the casualty. Then you want to check for response. Now obviously if they're talking to you, then they are responsive, which is great. So then you can ask them more information, and if they are responsive, you want to keep them warm and dry. You want to control any bleeding problems, and if they're having any difficulty breathing, you need to help them to be in a good position to help them to breathe. And if they have any medication that they've been prescribed for that, you would help them to use it. So if there is no response, you want to open the airway and check for breathing, which we've covered in lots of other videos, so I'm not going to go into detail here. If they are breathing, you want to put them in the recovery position. Again, we've covered that in many other Facebook Lives and also on our website. So we've got lots of resources and lots of diagrams and posters that we can send through to you that show you clearly how to put someone into the recovery position. And if they are unconscious and not breathing, then you would do CPR. So that's 30 compressions and 2 breaths. And if you're resuscitating a child or a baby, you would start with 5 breaths. So you are only going to call an ambulance if it is a life-threatening emergency. So please be conscious that, if they've cut the top of their finger off, they're not going to bleed to death. So you don't necessarily need an ambulance, but yes, you do need to transport them yourself to A&E. So think carefully about how and when you are using these important resources. And again, we've got another really clear blog post and further information on some nice helpful guidelines as to when an ambulance might be necessary. Okay, so you're on your own and you've established that the person is unconscious and breathing. So if you're on your own, put them in the recovery position first and then get an ambulance on the way. If you've got somebody else who can call, then get them to call straight away whilst you're putting them in the recovery position. If you have somebody that is unconscious and not breathing, if you are on your own, if it's an adult, then get an ambulance on the way, put the phone on speakerphone and start doing CPR whilst you're talking to them. If it's a baby or child, the advice is to do 1 minute CPR first before you're distracted by your phone to get an ambulance on the way. Again, if you've got somebody else who can phone for you, get them to get on that and make that important call. If the person is conscious, you're going to control their bleeding, you're going to perform urgent first aid, and you're going to get the ambulance on the way straight away if you need one. Okay? If you think that somebody is having difficulty breathing, and if you suspect they might be having a heart attack, putting them in the lazy W position, if they're comfortable in that position, can be very helpful. So nice upright position because they're breathless, because they're struggling, their heart's struggling to pump the blood round, and and it's making it harder for them to breathe, and they'll be very scared. So as calm as you possibly can. If you know there's a defibrillator close by, then discreetly get one so that it's safely there in case you need it. And you will need an ambulance, so get an ambulance on the way. If if they have medication, it could be a GTN, it could be an angina attack, and you would then get them to take their own glycerol trinitrate GTN medication, which might help. If they start to get better, then yes, it was quite a severe angina attack. I would still get them checked out. And if they don't get better, having taken their GTN, then if they have a 300 milligram aspirin that they have been prescribed, then they should chew it at that point. And again, if the blood vessels are constricted, that can start relaxing them a bit and make it easier for their heart to be pumping the blood round itself again. If there's a possibility you think they may have had a stroke, again, it's really important to get them to hospital as quickly as possible. So signs of a stroke, you've got your FAST test, so check their face. Has it gone unequal? Can they smile? Can they raise their arms and hold them level? Can they speak? Has their speech gone a bit strange? And get help on the way quickly. There are clot busting drugs that if it's a stroke caused by a clot and they're able to get it in there quick enough, then they can actually reverse the damage. So if there is a delay on the ambulance when you phone the ambulance, then do say to them, would it be better for me to transfer them myself? And if you are confident to do that, then get them to a stroke unit as quickly as possible. And the ambulance services will be able to tell you the best place to take them. And if they've got a possible spinal injury, if they're conscious, keep them where they are. Keep them warm, dry, ensure that they're safe. And keep them still. So support their head and neck. So I've got it the wrong way around because I can't do it. So make sure you're not covering their ears and you're supporting, I can't do it on myself, you're supporting them like that to keep their head still. Talk to them, keep them calm, and don't move them, don't let them twist. So don't restrain them, but encourage them not to twist. If they are unconscious and they are breathing and you are concerned that their airway is getting obstructed, then you will need to put them in the recovery position. If you have other people to help you, you would do that as a log roll. And if they're unconscious and not breathing, then you start doing CPR. Whether you're worried about a spinal injury or not, if they're unconscious and not breathing, then obviously that's priority. I hope that's been useful. There are plenty more resources and lots of posters on our site, firstaidforlife.org.uk and on onlinefirstaid.com, and also in our book, where are we? Burns, Falls and Emergency Calls, and our new one that will be out next month, Slips, Trips and Fractured Hips for the slightly older generation. So I hope that's helpful. That's Emma Hammett from First Aid for Life.